Much, Nessa. I'm just going to give you a few words about digital ethics to frame this, and then I'm going to move on to discuss some of the issues around coronavirus and the technologies that are being used and the ethical difficulties and challenges these present. So what is digital ethics? Oh, it would help me if I could. Well, here we are. Some people think it's quite an abstract term, ethics. It's kind of hard to get your hands on. It's a bit different from the law or other more concrete topics, but we're all familiar with it. Ethics is about morals. It's about responsibility, accountability, transparency, and importantly, integrity. And it borrows, the concept of digital ethics is a very broad one. It borrows from diverse fields. For example, it draws on biomedical ethics. I'm sure everybody knows the basic principle of doing no harm. It's an obvious import. It also draws on principles of good governance that are often used in international development and also in organizational ethics and corporate ethics. It draws on ethics in health data research, of which there has been a tradition in recent years. Particularly, we've done more of this kind of work. From ethics in software development, issues such as privacy by design. From a social equity perspective as well as a community-based perspective, issues around rights and discrimination and digital inclusion. It reflects on a human rights perspective as well, which overlaps with the law, of course, particularly the right to privacy, autonomy, and fair access. And we're also seeing elements in digital ethics as we bring that together of concepts like responsible innovation, which look to the future as well as the present. I won't give you full details of all of these. You can check the slides later, and some of them are mentioned in this link to this presentation. To this paper. So digital ethics is a kind of new thing. It's very inclusive. It's a bit different from some of those very specific areas like data ethics or AI ethics, for example, or bioethics that have attracted a fair bit of attention over the last few years, and also this broader area of medical ethics. It covers all sorts of technologies, existing ones, emerging ones, and future ones that we only have a feeling for them being on the horizon, but want to anticipate. And it considers how these impact people in different contexts, from health, work, education, finance, media, lots of areas. Looks at the risks to privacy, rights, equality, health, discrimination, and other sorts of ethical issues. And it looks at how technology can also be used to become more ethical, to improve inclusion, to make things more private, fair, safe, to support well-being and strengthen trust. Finally, it considers how governance procedures, policies, regulations, and laws affect this, but it's not the same thing as information governance. It's close to, but not the same. Most importantly, it aims to inform accountability and social protection and lead to a fair society. And we are putting together an expert group to try and see if we can develop a manifesto or something along these lines for an ethical digital nation for Scotland. It may be a unique selling point for Scotland. It may be something that we can do particularly well. And Scotland has its own ethos and a history of work in this area. And we'll be capturing evidence and expertise and public opinion to flesh this out. So that's a bit about what digital ethics is, and obviously it's critical as we move very fast in coronavirus. We are trying to innovate. We're on a Zoom call just now because we can't be together in person, and this is raising some new challenges. This is a new and rapidly spreading disease. It's also quite deadly, and it's also quite frightening. So this has heightened the needs for data to manage all of this extra sickness, but also needs for surveillance, and finally needs for compliance, which create other issues. It's also embracing multiple technologies Obviously, some of them that we are using at the moment are converting things we do already, like turning a face-to-face consultation into a digital one, for example, in primary care. And that comes with issues around security and so forth, but it's a similar process to what we're used to. But out in the wider world around COVID technologies, there's a much broader set or universe of innovations, some of which we might be more comfortable with than others. It includes information systems for operational purposes and data mining and analytics of the kind we do already in public health and the NHS. So again, it's got some issues, but not necessarily things that we might be frightened of or that are particularly new. On top of this, we have many new approaches for passive surveillance that you will have seen in the coverage of activities in other countries and some of the discussions about what's going on or might go on here. Things like thermal imaging cameras, facial recognition technology, and things that happen even further at a distance, analyzing your social media conversations or web searches to look for signals of disease or conditions that might be sick and no one else can see you being sick. And as part of that, there's also a large interest in participatory surveillance systems. These are things that we actively engage in, and they include mobile phone apps, and that are for perhaps helping us to identify the location or understand who we've been close to. There's proximity tools, or for reporting our symptoms. And finally, the things that are presenting ethical issues are more coercive systems, systems for making sure we obey the law, making sure we stay at home during a coronavirus lockdown. Digital wristbands or ankle cuffs, similar to what you would use when you release prisoners on probation, are being used to monitor people at home. Likewise, very precise geolocated data to ensure that you're at home. In some countries, one is having to flash up one's face onto the screen every few minutes so that the authorities can know that that is in fact you and you haven't left your home. And more of the perhaps things that we're less aware of, that are apps and reporting tools are requiring more and more of our personal data and may actually require certain types of access in order to derive any benefit from them, which sets up these relationships which are potentially quite coercive. Now, clearly, there are huge cultural and political implications of all of these. In some countries, they are using all sorts of extremely privacy invasive and coercive technologies. This is facial recognition in Korea, I think, and drone surveillance in China, for example. But these might not be acceptable in Europe, in a Western democracy. In fact, we're pretty active in terms of campaigning against this sort of surveillance. Although public health authorities and researchers are quite sort of greedily eyeing these up as possibilities for us. And this takes me to the question of all the different agendas there are at play here. It's not simply a question of delivering services online. There are many people wanting the data, some of them to do more efficient and effective public health, more rapid analytics, build new algorithms, for example. Government departments that might want to share them with other government departments you might not necessarily feel so happy with, local authorities, medical researchers, and importantly, the private sector is moving in quite heavily to this area, some in just providing technologies and devices, others as huge subcontractors looking at data analytics and so forth. And of course, down at the bottom there are the citizens, which should really be at the top. So our top digital debates in Europe are not really around drone surveillance and all of this type of thing, but they're actually around more immediate needs. And the first one is around contact tracing and proximity tracking. Now, contact tracing is not a new approach. It's a well-worn approach. But it actually, since we rather foolishly let loose the disease after stopping contact tracing briefly, it made life a lot more difficult to keep up with the volume of people that were out there potentially with disease. So looking for these mobile phone-based solutions to try and allow people to identify who they've been next to, so that if they become sick or if somebody else becomes sick, a message can be sent that says, contact your health services or order a test. Now, it's all very well in theory, but of course it does create questions. Now, we have moved away. We're in the UK. We're not well, not always actually. In some cases, we're not necessarily using very precise geolocation coordinates that identify you. It might be more anonymous Bluetooth beacons that send these handshakes, which change their cryptographic codes regularly, and so forth. So there are some protections there, but it's easy to after a while, by association, work out who you've been with, and they're not without their problems. Bluetooth has its own security problems, for example. But critically, the question becomes, well, how many people do you share that with? And particularly, is it centralized? Is it linked to a central database? Do they have a code with your identity in it first, which is the plan in NHS England? Or do you keep that solely on your phone, so you've been near someone and you can make a choice about whether to report, but the authorities don't know who you are? Now, that's been a source of a huge debate. It's become highly politicized to the point that some governments have had to give up their plans and change tack. Germany and Ireland, for example, have moved to these decentralized systems, which have been promoted by privacy advocates, but also by Apple and Google, who have now installed it on their operating system. But it's not as easy as that, because that doesn't actually get you off the hook as far as your privacy breaches are concerned, because in order to make these things useful, they tend to have apps connected to them, and they may have all sorts of other permissions involved in them and other sorts of tracking in them. And for example, just today, it was announced the NHSX app is going to include facial recognition, so that it can then not only identify you, but also perhaps use some of the data you've got for things like immunity passports, which again is a controversial issue. So but those are the main, that's been a hot topic, and I don't have time to go into detail, but I've written an article about it, which I could share. Secondly, is this question of data, and we're all obsessed with getting data, and all the scientists want loads of data, and the government want lots of data, and it's become great excitement about how much we can do with data science, and some of that's all well and good, but the question becomes, who's in control of that data? For what purposes is that data being used? Where are your rights for privacy? And these have led to enormous debates, particularly as big private sector corporations have moved in to run some of the analytical services, creating really difficult questions about ownership and control, as well as some around conflicts of interest. And again, any of you, I'm sure many of you have been, given the audience here, will have been paying attention to these sorts of debates, and mostly actually occupying the government in England rather than in Scotland, but something we absolutely need to be vigilant to. And finally, linked to that is the question of mission creep, which is the dominant theme. So people worrying that you might say yes to something, like having your health records mined, or using an app for reporting your symptoms, or to allow your location to be tracked, for example, but then perhaps not quite knowing that data is kept for a long time and reused for other purposes and shared with other parties that you may not be happy with, or linked with different sources to profile you. A key example is the social graph that can be calculated from location tracking. Even if it's anonymous, it can still perhaps identify you that way. So and finally, this question that I'm particularly interested in is the increasing role of kind of security, military, police, defense type bodies in this health space, to such an extent that we may be setting things up to essentially criminalize us for not doing certain things, for example. And is that what we want our digital health to be? Maybe if there's a massively harmful disease that is spreading around and killing everyone. But as we move down the risk thresholds and those levels of policy, perhaps that's not quite so important. We might want to draw the line. So let's think framing the question. So these are the main questions from digital ethicists, if you like, and also public commentators and privacy advocates and so forth that have talked about COVID-19. They relate to the technology itself. Will it work reliably and safely? Because obviously if it doesn't work properly, you could, get bad advice and maybe even die. Is it secure, or is it hackable, for example? And its privacy policies are related to that. Will it use only the minimum necessary data? How anonymous will it be? Will the data be deleted after the coronavirus outbreak? And how useful is this product? Does it actually do what it says it will do? And is it worth the privacy trade-off? The people behind it, are they being truthful and transparent about the project's ambitions and scope? And the institutions delivering it, is there sufficient oversight and accountability? Did they actually consult stakeholders sufficiently to understand what their privacy tolerances are? And its effect on people's autonomy and rights, as I've mentioned. Are you free to choose it or not choose it? Could it restrict your liberty? Could it discriminate against you? And these are all questions that are being asked. And one of our challenges in trying to get this right is everything's moving very fast for a start. So you can't do all the sort of normal consultation that you might normally do in the same way. But also the language is very complex. There's all these technologies and components to the technologies and different things they're doing. And there's all these acronyms going around confusing everybody. So you see contact tracing technologies labeled as something else. And, things are being mislabeled and it's confusing everybody. And the acronyms they're slightly narrowing down as certain players take the front of the stage, but they're still there and complicated, and certainly complicated for communicating with members of the public. And as I said before, the value propositions for different tools, they change as the threat levels change, as the stage of your pandemic management changes. And we need to take account of that and not just have a one-size-fits-all. And there's not much evidence on what publics think are acceptable. And there really hasn't been that much transparency. In general, lots of centralized decision-making, a lot of closed shop algorithms and modeling has gone on, for example, as you'll be aware of, but also around the design of these technologies. And a failure to share the codes, the plans of works in progress, for example, which has led people to become anxious, fearful, invent things, perhaps misinterpret things that they've read. And some fuzzy accountability, as I've mentioned. But what are the specific risks for Scotland then? These are, much as I've said before, communication. We need to ramp it up and make sure all of our stakeholders are communicated with, find the right language to use that reduces these things to an accessible way. Be conscious of those changing value propositions. Get some evidence and consult people, even though it's hard, there are ways to do it. And be absolutely transparent about what we're doing. No backdoor secret little developments, no backdoor data sharing or things snuck in at the last minute. Absolutely upfront. If you want to collect the data or you want to have a particular use, just say it. People are grown-ups. They don't like to find it out later on. And it's fuzzy accountability, between a lack of separation between different areas of accountability in terms of technology. And some of them are more technological, some of them are much more to do with health data, and it can become quite complicated. And there are some other important issues that I don't have time to raise just now. But the take-home message is that really it's about public trust. It's the most valuable asset we've got, and it's very vulnerable. The New Zealand government got where it did using these technologies it developed because of trust, because everyone trusted the Prime Minister. And they're at risk of potentially losing that through the threat of suddenly sneaking in Bluetooth on through an update, which is, that's an example of how trust is on the verge of being broken. We need to be careful about that. And we need to have, as I said before, transparency, accountability, and involvement. And not just innovate for the sake of innovation. We need to have a good reason to do it, and not sort of see this all as a great opportunity to do stuff we would have done or we wanted to do but couldn't get off with before. We absolutely must have a proven reason for doing it, and communicating this well. And I've mentioned no back doors before. So that's all I want to say. And there are obviously a huge number of issues that I could be sitting here all day talking to you about, but that's just a few. Thank you.
Thank you, Claudia. I'll just swap over to Ailey's presentation.
Many thanks, Nessa.
Okay.
How do I get out of this?
Hi folks, while Nessa's bringing that up, I'll just do a wee bit of an introduction. It's always good to see who you are before you launch into your chat. I hope you can all hear me clearly as well. I've got my headset on to try and minimise background noise, and hopefully I won't need to cough, but if it suddenly goes quiet, it might be that. And please be assured I don't at the moment have COVID and I'm not tested for it, so hopefully I'm all okay. So my name's Ailey McLaughlin. I am the Associate Director for Information Security and Governance, and that is within NHS National Services Scotland, and more specifically within that in the digital and security section of that. I must say that I head up the most amazing team. I am incredibly lucky with the people I work with, that they are all experts in what they do, and that they have just been absolutely amazing over the last 12 weeks or so, when we have been dealing with all the responses that we've needed to put together for the COVID-19 pandemic. I'm about to talk about test data and shielding. They're connected in some ways, but not in others, so I'll try and make distinctions clear. And the team have been absolutely amazing in supporting and helping in the work that needs to be done around about test data and shielding. So it just goes to show you that, you know, pandemic or not, we've pulled together amazingly well when we need to, and it's certainly been needed and much appreciated over the last 12 weeks. I must also say that any views that I'm going to say here are my own, and are my own reflections on the period of time that I've been working on these items. So just to make you aware that although I represent my organisation, I will, when I'm saying my own views, I will make that perfectly clear. So hopefully I'll be able to move the slides on. Oh, yep, here we go. So background. So shielding, I will tackle shielding first. It really is a whole topic in itself. Most of you hopefully are aware of the shielding policy, but just as a quick recap, basically the shielding policy is that there are 6 identified groups of people that are required to stay completely indoors and isolate themselves for, it was initially a period of 12 weeks, which will be running out soon. And from there, they have to ensure that they get all the support that they need to basically deliver to their door, which is a lot to ask. I mean, we've all been in lockdown, we've all been restricted in our movements, and I think we can all see how frustrated we have been in terms of that. But to be asked to ask, you know, for people to stay indoors completely is a tall ask. In relation to the shielding people, there was quite a lot of work to be done in terms of making sure that they were properly defined as a group, that we may manage to find everybody who was within those categories, and that we then treated them equally and managed to communicate with them effectively. And I'll come on to that in a minute about what did we do, Shield. What did we do, slide. In relation to testing the population, this is a bit different. So initially it was particularly key workers that were sought to be tested, but obviously as we've moved on from even when these slides were written, we're now expanding that out to anybody in the population, including children over the age of 5. So it's a vastly expanded field now, but when we were initially talking about testing the population, it was particularly for key workers, to allow key workers to continue doing what they did, which was so valuable in the areas that they were working within. And that includes NHS, but also includes our care home partners, it includes local authority colleagues, it includes down to people delivering parcels, etc., and making sure that goods flow about the country. There's a real challenge when you're testing a population about how you make sure you set up enough test centres, how you make sure that people know about these test centres, have access to them, how do they book a test, how do they self-refer for tests, and that has been helped by UK government in terms of setting up a lot of the infrastructure, but we also have Scottish infrastructure, which again I'll talk about in my next slide. This is against a background of government targets and promises. I think we're all aware of we'll meet a certain amount of tests a day that was promised by the UK government, which is soon to go up to 200,000 tests a day, I believe by the end of this month, and we've only got a couple of days left in this month to make that figure. I think the figure hovers around at the moment about 110,000 a day. So, you know, it can be quite challenging when you're responding against that backdrop, because obviously the population need to believe and have the trust in leaders to make sure that what they're saying can be delivered, and that piles pressure onto the system. I've mentioned some of the operational considerations: test capacity, test sites, employer referral. These are just a few of the things that you have to think about when trying to set up a massive testing program like we have got. And then on top of that, that's where some of the people within our profession come in, about the data governance considerations around that. How do we make sure that all the data that flows around a testing program is safe? So from booking the test, to turning up to the test, to having the test taken, to having those results analysed, those results then being transferred either to the health board or to the person themselves. How do we make sure that across that entire system everything is kept safe, secure, and done in line with ethics and the best interests of the people at heart? In terms of what we did, hopefully I'll be able to move on. There we go. What do we do? So it's been really, really interesting. If I go back to shielding, which is the bottom right square on this slide, in relation to the shielding data, we had to, as I said, identify everybody who needed to be shielded, who fell within the categories. And well, we identified that they needed to be shielded. Whether they wanted to be shielded and whether they opt to shield is a completely different question, and not one I'm going to answer today. But basically what we had to do was identify those people. That involved pulling data in from various different sources, data sets that are already held. We also had to look south of the border to NHSBT, that's blood transfusion down in England, who hold the registry of people who have received organs, because they fall within one of the categories. So we were pulling together data from across a vast range of data sets to try and ensure that we didn't miss anybody. We needed then to double check this data to make sure that it wasn't going to cover anybody twice, or indeed worse, that we were going to write to people who had sadly passed on and therefore cause pain and grief to their relatives. We had to make sure that the data was accurate, that it was up to date, and that we were going to be writing to people at their current addresses so that we could ensure that the message reached them. We also had to be really clear about what message we were trying to put across, and that's quite difficult when you're writing out on behalf of the Chief Medical Officer, but you have many other organisations involved, and we had to try and take quite a pragmatic line on that. I say we, this is myself and Scottish Government colleagues. To date, we have done 4 rapid assessments. These are data protection rapid assessments. These assessments have been created through Scottish Government and also through NHS Scotland IG leads. And the rapid assessment basically takes the place of doing a full data protection impact assessment at this point in time, so that we can move quickly and get governance in place that we needed to get in place, but with the understanding that at the end of quite a small time frame, you would go back and do a full data protection impact assessment to make sure that there was no gaps in governance. We had to then consider whether there was any other things that we needed to ensure was in place. So we've got data sharing agreements in places, and we've got approaches from other organisations and cross-border considerations in there. I'm aware of time, so I'm going to start speeding up. In relation to the testing data, we put in place a Section 255 letter, which is under the Health and Social Care Act. It's quite rare to do this, but basically that's a processing letter where we ask NHS Digital to process data for us. Alongside that, we've also done rapid assessments, and we've also carefully considered controllership. And then amongst all this, we have to make sure that our privacy notices are up to date, because communication with the public is so important. I'll move on to the next slide now. So basically, we have to do a balancing act amongst this all between ethics, speed and accuracy. Ethics had to think about, are we doing the right thing? And I'll come on to some questions just a moment about that. Speed, we have to consider about, the deadline was always yesterday. So we had to make sure that we were keeping up with the demand, but at the same time, not letting anything pass through the net or as much as possible. And accuracy, we have to make sure that we are evaluating the correct process, so we understand the process, have we got it right, and making sure that we still ask ourselves those penetrating questions, and importantly seek peer review to make sure that was happening. The bit in the middle where that all meets, that's where we create trust, we create governance, we create assurance, we create transparency, accountability, and we also create an audible trail that we can go back and refer to, but we can also be transparent with the public and say this is what we've done. I'll just move on to my last slide and I'll go through this very quickly because I'm aware of time. So the digital ethical principles that are the sort of usually recognised ones I've put on this slide just to make sure everybody recognises where I'm going to go next. And looking at these 4 areas, I picked out particularly some 4 big questions. The biggest question of all, and it cuts across all these areas, is are we trustworthy? And doing the things that we're doing, we have to maintain that trust with the public. Otherwise, the game we may as well just pack up and go home. In terms of autonomy and decision making, one of the things that was striking me was there sufficient public participation in what we were doing in order to make sure the public understood what they're doing and that they bought into what we're doing. And that's probably an area where we've been lacking in all of this, because there's not much ability to do that at this moment in time. So we have to try and be clear in the messages that we push out and through privacy notices that we are trying to do the best we can and invite that engagement, and also not ensure that people's rights are then not impacted by whatever we do. We have to try and balance the benefit between subjects and users, and it has to be fair and reciprocal. That's looking at fairness and lawfulness. We have to make sure that what we're doing is legally right, but also is fair across the piece, that we can take into account all considerations in that. We have to make sure we're not compromising rights to privacy. We have to make sure that we're not compromising people's autonomy's rights or their rights to fair access to their data. And finally, we have to think about how this aligns with societal values. And that's what I've written down there, changes to the collective moral code, because ultimately what we're doing has changed the landscape, and we need to make sure that when we come to the end of this period that we reflect back on that and make sure that the ethics that we're working to at all times are sustained, that they are communicated well, that they are participated in by the public, and that above all we maintain trust. I will finish there. I'm sorry it was a bit of a canter at the end. Thank you very much for listening.
Thanks very much, Ailey. And I'm coming to the conclusion rapidly that we probably need a webinar for every single one of these topics. So just bear with me and I will swap over. Next up for us is Richmond Davies. Richmond is Data Protection Officer, Head of IG, Stats and Strategic Development, Public Health Scotland. I should have asked you to actually introduce yourself because that would have been quicker. So bear with me just a moment while I get your slides up, Richmond, if you want to comments. There we go. Hopefully you can see that.
Yes, I can, yeah.
Okay, I'll hand over to you, thank you.
Okay, so my name is Richmond Davies. I work for Public Health Scotland. Public Health Scotland was launched on the 1st of April. We have the largest collection of statisticians and staff in analytical roles in the public sector in Scotland. And we're starting to have a growing number of data scientists as well. We process data about our citizens with regards to their interactions with the National Health Service from the prenatal stage right on to the point of death. We were set up to address Scotland's huge public health challenges and also to address the issues to do with health inequalities. As has been said, so I'm the DPO and I have a number of other roles as well. So I'll start by focusing on two ethical theories. One of them is consequentialist ethics, which holds that the rightness or wrongness of actions resides in the consequences of those actions. So it actually means that it doesn't matter what you do as long as you have an aim which produces some kind of good. And then on the other side, you have the non-consequentialist ethics, which holds that the actions are intrinsically good or bad, as long and they don't have any consequences at all. There's no dependency on the consequences. So two examples which I'll just go into slight depth. One of them is utilitarianism, which concerns the moral worth of any action is determined by its outcome. So the focus is on that big picture, what do you want to achieve? So the principal goal is happiness for the greatest number of people. As a result, individuals must not get in the way of the pursuit of societal happiness, so actual individuals. So for example, this is a hypothetical situation. You have a population of 10 million and 100 people. You exterminate a small portion of the population, say 100 of them, and then that results in happiness within the rest of the population. Then you have carried out a utilitarian act, because the majority of the people, the overwhelming majority of the people, are happy. So on the other side, we talk about individual rights, where individuals are perceived to have rights, all sorts of rights. These rights are set forth by society, and they are given the utmost and highest priority. For example, individuals can have a freedom of privacy and the entitlements to fairness. An individual can pursue certain actions without interference from others. They may refuse to reveal their personal details. In the data protection legislation, GDPR, Article 16 to 22 talks about all the rights that individuals have. However, we find ourselves in a situation where there's that balancing act. Yes, individuals have rights, absolutely. But at the same time, it is very important to think about that bigger picture, what you want to achieve. And in trying to achieve that, it is sometimes very difficult to find that balancing act. So where it is argued that utilitarianism and rights can live side by side, absolutely they can. However, it can also be argued that utilitarianism cannot justify all the moral rights that individuals perceive themselves as having. So an individual with COVID-19 attempting to withhold their demographic personal details and from the appropriate public authority can be perceived as being incompatible with understanding the pattern of diseases in society and finding a solution for notifiable diseases in society. But the law is there to support this careful treading of the balancing act. And these are theories which are extolled by eminent dead philosophers like Bentham and Mill, and also by John Locke. So if we go to the next slide. So one of the, in arranging that balancing act, we collect a lot of individual level information. So one of my staff was able to create this dashboard. It is updated every single day, around about 2 o'clock in the afternoon, and then it updates the world with figures on cases, positive cases in Scotland, confirmed daily cases, and the total number of deaths, broken down by health boards and broken down by local authority. To be able to do this kind of thing, we need to collect personal data about individuals, and then we aggregate them all up, and we have a process known as statistical disclosure assessment, where we believe it is good enough for public consumption. But then sometimes there's some decisions that need to be made. For example, on the dashboard at the moment, you can see figures in Orkney are quite small, at 7, Western Isles, 6. And this is the balancing act. Those 7 people would know who they are. But there needs to be this balancing act, because we are thinking about this bigger picture, this utilitarianist point of view. So I just wanted to just point out to you the decisions that have to be made for the good of Scotland. The next slide, please. The next slide. So in addition to that, my team also publishes open data. So we have two types. One, which is every single day, we have open data on COVID-19 activity. And then every week, we also have slightly different configuration of open data on COVID-19 activity. This is in response to people in Scotland who want to innovate. They want to develop apps, they want to develop their own dashboards, they want to use what we call APIs to feed, to suck up to point to the data that we publish every day, and which feeds into their application. And so these are the things we have to do for the benefit of the country, while being mindful of the fact that individuals have rights, and those rights need to be respected. But it's very difficult all of the time to be able to uphold every individual's rights. And the law helps us to navigate that careful path. The last slide. And I think this is it. That's all. That's my presentation. Thank you.
Thank you very much, Richmond. That's fantastic. And I am going to pause share again and swap over slides. And I will then go to Claire Wainwright, who is next up. So just again, please bear with me for a moment while I do that. And Claire, if you can unmute yourself if possible.
Sure. Is that it?
Yep.
I'm muted.
And we now have your slides. Hopefully everybody can also see those. Yep, that's us sharing your slides. So if you just let me know when you want to go next. So it's on your title slide, if you wouldn't mind introducing yourself, Claire. Thank you.
Thanks, Nessa. Yeah, my name's Claire Wainwright. I work with Roger Halliday. He's the Chief Statistician and until recently Chief Data Officer for Scottish Government. And I've worked in the space of information governance and also with the programme of data linkage projects that we've supported and with colleagues in IDRIS through the system. I'm working at the moment well, some of our team have been pulled directly into setting up this COVID data service for research, which is servicing all the demands for the use of Scottish health and other data for research on COVID-19. I'm not directly involved in that, but I'm working with the services to sort of set up what a new body that we're calling Research Data Scotland, that will bring in IDRIS and the platforms that are hosted at the University of Edinburgh. So I know a lot about information governance, and I also worked last year with colleagues elsewhere in my directorate, in the digital directorate, on digital and data ethics and some of the issues we're taking to the UK government about this. They have a Centre for Data Ethics and Innovation there that is engaging with the Scottish Government. Yeah, I think really, I've just put a few questions down, a couple of slides of questions. I'm not really involved in exactly which data sets are being pulled together to answer which questions around COVID-19. But I think just approaching this from, the way that we have view the way that we treat existing issues and existing ethical challenges and dilemmas and risks around the use of data, what starts as personal data and goes on that long journey to become what becomes anonymized data. So so this was really just about focusing on research, and I think it reflects some of the issues that have been raised by others presenting. And I guess it's really just thinking about the existing systems and the objectives that we have for research and for the use of data to support that, and just reflecting on do they need to change or are they fit for purpose? What are the ethical challenges and pressures that that are coming to us newly in the COVID-19 research? I guess early days yet, because I think the research is only just getting off the ground, but it would be useful to sort of share experiences aware that the processes for that are changing, and just understanding what some of the issues are in the research that's being done, whether they're simply of a UK nature, are they related to the data, are they related to the way that the questions are being posed, and how are they being considered, how are the ethical dimensions to some of what we're exploring, how is that being considered. And again, I think sort of separating out some of the short versus longer term ethical issues in the way that we set up the research agenda around COVID-19. You know, are there trade-offs, and are we always aware of those? Are there some things that perhaps that perhaps we're not thinking about, and things that we're setting up that may have longer term consequences for you know, for what we get from research later on, that we might need to take account of now, and in the way that we make ethical considerations about the research that's being done for COVID-19. And I suppose that sort of leads to the point about, do we understand the costs and benefits? I guess that's the ultimate sort of, you know, we want to be really clear about what we want to achieve, and be able to draw out where those tensions are. I think you know, the point about governance Claudia made earlier, accountability. You know, we have you know, large research programs taking shape really, really quickly. You know, the research councils are trying to sort of get money out the door to, you know, promote and support the research. And I guess it's just making sure that that process is clear, and has clear accountability frameworks built into it. And just onto the second slide, Nessa. Sorry, I've jumped onto the first set of questions. So just the few questions to end, just the transparency and openness. You know, we try to lead and participate in conversations with Civic Scotland, and with the organisations and individuals and networks that we have when we explore change. And I think that when we're faced with such a you know, a sort of immediate demand and need to respond, sometimes, you know, we're not able to engage as effectively and as widely. And I guess it's just making sure that that doesn't become a sort of, you know, embedded model. Got back to one of the points raised earlier, just about mission creep and things that are, you know, temporary becoming the norm. And I mean, so I suppose it's separating out why we are making the choices we're making short term, and what the implications of that is. I guess just how can we build on existing strengths in research ethics? We have many structures in Scotland, and ethics panels and expertise, and how can we use that to support us in addressing some of the challenges? And I think just learning coming out of probably the next 18 months, how will we evaluate how we responded, and you know, what would be the criteria for success on that for example, research on COVID-19, and then just the process. I think something about the process and the research process. Who shapes that? Who shapes that research process? And just, you know, being aware of the sort of, you know, wider picture of you know, some of the issues around you know, the way that research is framed and developed, and this wider social impacts of that. Issues around, you know, some of the issues are about the data and what's captured and what's not captured, and who's not captured, importantly. I think that's probably enough. I don't know if that I think that's the end. So just some prompts there, really, just to get people thinking, and hopefully be able to come together on some of this.
Thanks very much, Claire. No, that's really good. Nice to have some reflection and some kind of thought-provoking ideas as well. I'm just going to share Elena's presentation as we hand over to Elena next. Just bear with me. Slide.
Hello, everybody. As you carry on, I'm going just to use a moment to say hello to everybody and quickly introduce myself. I'm Elena Verazarvide. I work with the Scottish Government. I'm the National Information Governance Policy Lead for Health and Social Care. I work in the Digital Health and Care Directorate, and I work with most of the people that are presenting today. Thank you very much, Nessa. I can see it.
Hang on.
Yeah.
Okay, there we go.
Thank you.
Thank
That's
you.
fine. I have a very short presentation today. I think that my time today was more about creating the opportunity to pause for a few minutes and reflect on how we are making considerations about the ethical implications of our digital and data actions during COVID. Share with you what we think we are doing. And again, this is about perceptions, and this is what we think we are doing, but you might have different thoughts. Certainly because of my role, I have been involved since the beginning of the pandemic in work around strengthening the adoption of digital technologies and data sharing in many areas across health and care in Scotland. There are many ideas and many solutions presented out there, and we have been encouraging the adoption of these digital technologies. So I'm part of that team, and my role has been at somehow, from the information governance perspective and digital ethics, make people think and ensure that we are doing the right things, and at least make people think for a moment if we are happy with the actions that we have taken. Seems to be obvious that the fight against COVID can benefit from information technologies and data, and we have heard already from other people in this panel today how good this can be in the COVID battle, but we also have heard that this can be a very difficult balancing act, particularly when uncertainty is high in many ways. There are many ideas about great things that technology and data can do for us to help in this fight, but how are we going to choose which ones are we going to move forward? How we decide if it is worth spending our limited capacity, because that's important to take into account, because we have no capacity to roll out everything. We need to focus the efforts with the limited capacity and time that we have. So how can we choose to ensure that we go for the best possible solutions amongst others, and to be sure that is the best decision? One of the elements is, as Richmond mentioned, how worth is the outcome or the predicted outcome of what we are doing, but also is how ethical is this? Are we doing the right things, taking into consideration the greater good, but also the people, individuals' rights, and in this sense. So many of these ideas are great, but we need to consider if they are definitely ethical, and if these ideas, not just because we can deliver, we should adopt these ideas, and therefore which ones are we going to choose. Decisions certainly need to be balanced. Decision time these days is very short, and visibility, I hope most of the speakers here today would agree that visibility is foggy these days. So there is a lot of uncertainty there, and we have to still make decisions with what we know and we can see. And sometimes things that we cannot see is the potential harm that things can cause. Or when I say harm, I want to use the term in the wider sense, okay? So for example, things will have an impact. These decisions will have an impact in people's rights, in the we will impact the digital divide. We will have other consequences that are not necessarily the ones that we are looking for, but are collateral effects, collateral things that are going to happen. To see that in a short time, sometimes it's very difficult. So definitely, if something, this is a very difficult balancing act that we have to undertake very quickly. We have to actually also take into account that some of these decisions are not just bound by the timescales of COVID, but they will carry on in the future. Oh, thank you, Nelson. I forgot to move the slide. Thank you. So we need to keep that in mind. Okay, so we are putting in place some solutions to solve today's problems, but in the later on, when COVID is over, then we will have to reconsider if some of the decisions that we have made still, or the solution that we have put in place should continue, should carry on, or should stop. We know that when pressure is at the highest, we all tend to jump straight away into delivery mode or solution mode. This is understandable. However, we have the collective obligation to think about it, take a moment to challenge our thinking, even if this has to happen in a very fast way. Some of the decisions made during COVID, as I said, will carry on in the near future. Therefore, it's really important that we spend some time in these considerations. Decision makers have a social obligation to take this responsibly, ensuring that there are processes and capacity in place to challenge the thinking from the ethical point of view. So we will find teams that are ready to go, jump straight into delivery mode, but we need to have these processes and this capacity, these other people that can help with challenging the thinking from the ethical point of view. There are many measures being put in place to ensure this happens. Some of these measures involve legislation, but not necessarily. I mean, we have seen some countries have introduced data sharing laws and regulations around COVID. Some of them are to ensure that important data is actually is not kept captive, is shared because it's needed in order to tackle the pandemic. So it's not just about protecting privacy, but it's actually ensuring that data is shared to help making these decisions. But also to ensure that this is done responsibly and fairly and lawfully. And as somebody mentioned already, in a very transparent way. Some other countries are even thinking about legislation to protect their economies. And I'm saying that although we are talking about digital ethics, there are, I mean, the big technology companies have a great impact in the solutions that we are delivering today, and they have a great impact in the economy. There are countries that are talking about, well, the United States in particular, they are talking about an anti-monopoly act for big tech and pharmaceutical companies in times of COVID. I'm not criticizing and I'm not giving an opinion about that. I'm just saying these are things that are happening and countries are considering. Other people might think that creating this sort of anti-monopoly legislation might seem good at some degree, but for others is an inconvenience, because many small companies might think, well, actually, that's my dream, be absorbed and bought by one of these big companies, especially in times where there is a COVID economic halt. And so it's not that obvious what is good and what is bad, not just from the particular individual, but from the greater society as well. And not only in terms of health, but also in terms of the economical or the economic impact of these decisions in society. There are also a number of measures taken in terms of agreements between governments, healthcare organizations, and universities and other organizations involved in the data flows and the delivery of these solutions, just to ensure that the data flows happen, take place, technologies are efficiently used to help in the fight, but also to ensure that the chances of misuse of data harvesting, for example, for research is done in a way that well, is minimized, but if there is any data harvesting, is a positive data harvesting and is done ethically and in line with data protection and privacy requirements. Other sort of measures, as Elif mentioned earlier in her presentation, are related to tackle or make the processes more efficient. So for example, the Scottish Government and the NHS Scotland have worked together to develop these rapid assessment tools, streamline important information governance processes in order to allow sort of fast track scrutiny of ideas, of proposals. The Scottish Government has also prepared what we call digital ethics sheets, and the idea is that we summarize somehow the ethical principles of beneficence, non-maleficence, fairness, and lawfulness, transparency, and also how they impact people's autonomy and privacy around decisions where the Scottish Government is leading on these solutions. So in summary, my point for today is all these proposals have a great potential, but also may bring undesirable consequences in areas of privacy, people's rights, the wider economy, long-term impact, or simply worsening the digital divide and calcifying disparity somehow. So therefore, we need measures like the ones we have mentioned today, embedding legislation, developing fast-track processes, tools, guidance to allow, give room for a fast scrutiny of ideas. So things need to happen fast, but let's create create a space to do it fast, but do it, not just ignore it before these solutions are rolled out. But also once this is all over and we have to rethink, okay, which one of these things could be kept because there are very good things and we don't want them to stop after COVID. And finally, this is not easy. It's a difficult process. It's a difficult balancing process, especially when speed is crucial. So that's my point today.
Thank you, Elena. Thanks very much. I really like that point about fast scrutiny of ideas. Don't ignore it, keep doing it, but maybe speed it up a bit. I like that idea. And I'm just going to hand over now to Emma Gillies. Emma, if I've mispronounced your surname, I apologize. I'm pretty notorious for doing that.
No, that's absolutely fine. I'm used to all sorts, but it's Emma Gillis.
Gillis, right, okay.
Yeah.
See, I knew I would get that. I would get one. Right, let me just quickly do this and swap over again.
You're doing a great job, by the way, Nessa.
You would think after so many webinars in this 1 week that I would actually be a bit slicker than I am, but anyhow, we learn and we go. Okay, so Emma is our final presenter in the session, and after that we will have time for chat. And I should also just say that Penny Rocks from Scottish Government, Penny is Head of Governance and Technical Assurance with the Digital Health and Care Directors. Penny is with us as well on the call, and she will help to field some of the discussion following Emma's presentation. It's great to see so much going on in the chat, and that's exactly what we want, people to be able to have some of these reflective points shared. Okay, Emma, over to you.
Thanks very much. Well, I'm conscious that we are short of time. I am Emma Gillis. I'm the Managing Partner for Gartner Consulting in Scotland, Northern Ireland and Ireland. But Elena asked me to cover off a research paper which our Gartner research colleagues had produced in response to the COVID-19 response specifically around data ethics and about making decisions in COVID-19 times. So I will scoot through this, and happy to take any questions afterwards. So obviously everybody will recognise some of the key challenges that we're facing specifically around data at the moment. And data ethics is really kind of front of focus because of the amount of data collection that's going on, and the use of data is kind of key to helping to address some of the issues that COVID-19 is presenting. There's also the evolving expectations of value delivery from a kind of end user point of view, that if I share this data with you, I expect you to do all these wonderful things with it. And it's managing the expectations in terms of the art of the possible sometimes with that data, particularly when it's coming from many different sources and is in many different states of quality. And particularly because of COVID-19 at the moment, there is a variance in how data is collected, how it's being used, and some of the practices around it, which are not normal, and that's absolutely understandable given the situation we're in, but it's kind of key to recognise that. And if we could move on to the next slide. I just wanted to quickly give you Gartner's definition of data ethics. It concerns itself with the responsible collection, use and sharing of data, guided by moral reasoning to do the right thing at the right time and for the right reasons. And obviously that's kind of key at the moment. Gartner's developed a 3-step model for applying data ethics to data collection, and also the use and sharing of it during COVID-19, which, if you wouldn't mind going on to the next slide, Nessa, outlines the 3-step model there. So basically, the 3 steps are around contributing. So because we're in this pandemic, you know, data collection is really at the core of a rapid crisis response, and using that data to inform decisions quickly and in a very flexible way. So almost every country in the world is collecting data about new cases of COVID-19 and creating predictive models to match expected growth projections. So in order to do that, they're pulling data from a number of different sources. That's absolutely fundamental to getting to the right kind of data input and then making the right decisions based on that. But it does mean that you must safeguard against the misuse of that data, and particularly when you're sharing it across multiple sources, that you are sure about the that people are clear about what that means for on sharing of data, so that if you're sharing it with this person, that doesn't necessarily mean that they can then share it with other people without your consent. So that's key. Then collaborating. So in terms of the ethics itself, it's about seeking multiple perspectives. So the key from the research is not to make decisions in a dark room, and that goes to some of the comments that are in the chat. It is really to be very clear and transparent, first of all, about taking different perspectives on data ethics, but then being clear about the decisions you're making, why you're making them, and justifying that. So it's, and I know in a time of a pandemic, public consultation, you know, being long and drawn out is not possible, but having conversations in an agile and flexible way is possible, and making sure that people are consulted is also possible without drawing it out too much. And that will fundamentally affect the way that the collection and use of the data is perceived. And then finally, and I think Claire mentioned this in some of the work that they're looking at now, some of the decisions you're making now will be really positive, and you want to keep those in place. Some of them might just be temporary, and we need to be clear that those are then temporary. And so then it's about outlining which ones you want to change, you know, the kind of solidify the positive changes, and also then learn from some of the lessons that you've learned and make sure that that's bedded into the way forward that you agree on. Gartner researchers also developed a data ethics checklist, which has 8 points mapped over 4 different topics. So regulatory, we mentioned legislation. Are there regulatory requirements for this data collection? And there could even be conflicting requirements, and how does the regulation account for that? Have the requirements been adjusted or waived because of the crisis, and is that a long-term thing that needs to be embedded in law, or can it be flexed to accommodate a short-term change but then reverts back to normal? In terms of risks, by doing this, what risks are we exposing ourselves to and others when collecting, using or sharing data, and being very clear about that? It could be, and it may well be the case that the risks are worth taking, but it's key that those are clear to people, and that where possible you can mitigate the risk by putting in clauses or making sure that, sorry, that's misspelled, misuse or reuse of the data isn't possible after the crisis is over. In terms of differentiation, what difference can we make by collecting, using or sharing this data and dealing with the crisis? So why are you doing it, and what is the point of it, I guess? And then how do we improve the lives of employees, customers, citizens, patients, care recipients, and actually make a difference as part of this data collection? And then lastly, the values, and this is kind of key. How does collecting, using or sharing this data stack up against your values? And do we believe that we're doing the right thing in response to the crisis by collecting the data in this way? And that is something that is obviously can influence the way that people view the collection of data, the way that they trust the collection of that data and the use of it as well. So it's kind of fundamental to the collection of data. I've whisked through that, but that's the end of the presentation. There is, I'll share my slides as well, so people have that.
Thanks very much, Emma. That's fantastic. Really clear. That's great. I will just stop sharing my slides. So there's been a lot of discussion in the group chat, which is, as I say, exactly what we want to have. I'm just going to reintroduce Penny. Penny Rocks from Scottish Government, Head of Governance and Technical Assurance in Digital Health and Care. Penny, do you want to just sum up with a couple of points, or do you want to throw it open to questions?
Hi everyone, can you hear me okay?
Yep.
We can.
Yeah, that's grand, thanks. Yeah, thanks very much to all our presenters. So some very interesting thoughts coming through there. There is a few questions coming up in the chat, and quite good to have a bit of a discussion about that. I suppose a lot of the themes are really around how do we do things in this rapid way? What are the consequences? And some of them we don't know the consequences yet, so we're going to have to recognise them as we move along. But what are the consequences of doing things so rapidly? And as we move away from the pillars of things that we've understood before around ethics, around protection of data, around how we put wrappers around everything that takes a while to do, how do we then move from that, which is our kind of known position and not without their own issues, into something that helps us ask the right questions, but in this manner, the way we have to do things very rapidly, and help provide enough information to make those decisions